Today, I'm delighted to welcome you to this incredibly relevant webinar entitled Navigating Medicare in 2025. So if you're wondering if you're in the right Medicare plan, we're going to take a look at some Medicare plans in 2025 and discuss a couple of sample plans that go along with Medicare Parts A, B, C, D, and Medicare Supplements. But before we dive in, I'd like to mention that all attendees will be placed on mute. However, during the presentation, if you have a question, please utilize the Q&A function at the bottom of your screen. I'll be facilitating audience questions at the end of the presentation to ensure our speaker addresses them. Last but not least, we will be recording this session, so if you'd like to go back and review any of the information that will be presented today, you can do so by visiting our YouTube channel. Okay, so we have important and valuable information to cover today, so let's get started. I'm excited to introduce our esteemed speaker, Kevin Lenham, President, Insurance Services with Capstone Inc. Kevin Lenham with Capstone Services is recognized 5-star Medicare agent in the San Diego area and began his insurance carrier in 2010. He works with all types of Medicare plans, including supplements, advantage plans, drug plans, dental and vision coverage. Kevin has been helping hundreds of people with Medicare and wants to answer your questions and give you information to make a decision that is beneficial both financially and medically. And with that, Kevin, the floor is yours.
Thanks, Will. Appreciate it. So again, my name is Kevin Lenham, Capstone Services, and I'm a local Medicare insurance agent in the San Diego area. And so thank you so much for joining the call today. Hopefully this will be really helpful for you. There are some folks on the call today that are not yet on Medicare, those that are going to be going on Medicare pretty soon, and those that have been on Medicare for a period of time. And so hopefully this will be a nice recap for you on the ins and outs of Medicare. And then also at the end, I have one sample plan that I'm going to be sharing with you today that is specific within the San Diego area. So I can't show all plans, but at least I can show one plan and kind of give you an idea some of the benefits that are available in that plan. So I also find that there's folks on the call today that are completely satisfied and happy with the network of doctors that they have and or the plan they have. There's others that are on the call that are maybe not quite as happy with their plan. And so hopefully I can be available to you. Customer service is very important to me. So after the call today, if you have any specific questions, on the last slide will be my contact information. So feel free to reach out at your convenience. No obligation, but I'm happy to be available and answer those questions. There are maybe folks on the call today that are shortly going to be coming off of group health insurance and have those type of questions as well. So happy to share the information to you. So we get started here. I live in the city of La Mesa. My office is in downtown La Mesa. But I can assist individuals all throughout San Diego, California, and I'm also licensed in several states. And so I want to kind of share with you a little bit about my family. My wife Brianne and I have been married. Next month will be 20 years. Our wedding anniversary is in November. And these are our 3 boys. This was a photo taken a year ago. My 3 sons, Crosby on the right, Micah's on the left, and my son Jasper's in the middle. Jasper just turned 6. So that's why I work as hard as I do to take care of my family. So the goal today right now is to kind of share with you about what original Medicare is, what the coverage and costs are, what it doesn't cover, the gaps in coverage, and then what is prescription drug plans, Part D, and then how to enroll. So again, the whole gamut on the call today, people are in different spots. And so whatever that may be, hopefully today's webinar will be able to provide a recap and then also share with you about the ins and outs of Medicare. So what is Medicare? So Medicare is a federal health insurance program for eligible U.S. citizens and legal residents. It's funded in part by the taxes that you pay while you're working. Medicare is not a family health plan, Social Security, Medicaid, or in California, Medi-Cal, and it's not free. So anyone on the call today that is already on Medicare should have a red, white, and blue card, Medicare card. It's a series of numbers and letters. It's 11 digits as opposed to years back when it was your Social Security number. Who can get Medicare? U.S. citizens and legal residents. You must meet one of the following requirements: be over the age of 65 or older, younger than 65 with a qualifying disability, or any stage with any end stage renal disease or ALS. So these are the folks that would be eligible to go on Medicare. Before I continue, as mentioned, there may be people on the call today that are in particular networks local to San Diego, such as Kaiser, Sharp, Scripps, or UCSD. I'm unable to assist within the network of Kaiser. They keep everything in-house. They work with inside Medicare agents. So I just want to be transparent with you there. I do work within networks such as Sharp, Scripps, and UCSD, and varying types of plans. Familiar names such as Medicare Advantage plans, Medicare Supplements, and prescription drug plans. So these are the four parts of Medicare. Part A is hospital care. Part B is medical outpatient or doctor care. Part C is a managed plan that combines Medicare Part A, hospital, Part B, doctor, and Part D, drug. And then Part D is a prescription drug plan. So this will just be a recap on when this came about. So in 1965, President Johnson brought forth Medicare Parts A, hospital, Part B, doctor. And then President Clinton in 1997 implemented Medicare Part C, which is more of a managed care plan. And then in 2003, President Bush brought forth Medicare Part D for drug coverage. So there's a lot of questions right now about Medicare Part D. We'll get to that. It's called the Inflation Reduction Act of 2025, which will cap medications. But these are the four parts of Medicare. Medicare Part A, again, covers 80% of hospital costs. And if you've paid into Medicare at least 40 quarters in your career, or your spouse has paid into Medicare at least 40 quarters in their career, then you're eligible for a premium-free Medicare Part A. If you've paid 30 to 39 quarters, then your Part A premiums for 2024 is $278 a month. And if your premium is, or if you've paid into Medicare for fewer than 30 quarters, then you would pay $505 a month for Medicare Part A. So those are the Part A costs. These are the costs for Medicare Part B. You'll see at the top of this slide, we are still awaiting the cost for 2025. There has been some estimations, but we don't have the numbers exactly for Medicare Part B. So there may be individuals on the call today that are paying $174.70 a month for Medicare Part B, possibly through their Social Security income. There's a deductible of $240, and Medicare would pay 80% of the cost if you do have Medicare Part B, and you would be responsible for 20% of the cost. Medicare would pay $0 for excess charges, which I'll go into in a little bit, and you would pay 100%. So it's important to communicate to you that one option would be to just simply have Medicare Parts A and B. You do leave yourself exposed, though, because you're only covered at 80% of the cost of care. So not the most ideal situation, but as long as you know that is an option. If we were to go into the costs associated for Medicare Part B, for doctors, if you file your taxes individually on the left column, and if your income is under $103,000, 2 years prior, it's your modified adjusted gross income. So it's always 2 years in arrear. Then your Medicare Part B premium is $174.70 a month. Subsequent, if your modified adjusted gross income in 2022 is $103,000 to $129,000, it's $244 a month. If you file your taxes jointly, and if your joint income was under $206,000, then you pay $174 a month and all the way up. The reason why that the premium could be higher on this level or this level is it's called an IRMA. It's a higher income earner adjusted amount. So for being a higher income earner, you pay higher for your Medicare Part B. So this is the premiums that you could be paying in this year. And then next year, it will go up some. The estimated premium for next year for this spot would be $185 a month. Don't quote me on it, but that's what it is estimated to be. It's estimated to go from 174 to roughly 85 a month. So what does Medicare not cover? What are the gaps in coverage? So all of the cost of your care, you have out-of-pocket costs with no limit. Deductibles, co-insurance for Part A hospitals, deductible and 20% of Part B costs for doctors, prescription drugs, dental, vision, hearing, eyeglasses, care received outside the US except for certain circumstances, excess charges, long-term care or custodial care, such as receiving care at home with help with the activities of daily living. So these are the gaps in coverage. So as I mentioned earlier, one option would just simply to be have parts A and B, but there are gaps in coverage that you have to understand that you will be responsible for. This slide presentation will also be available to you if you'd like. The last slide will include my contact information. So if you'd like this slide presentation, I'm happy to email that to you as well. These are the three options that you have for the additional coverage. You have option one, it's a Medicare supplement or a Medigap insurance plan. Option two is a Medicare Advantage or Part C plan. Option three is an employer group retirement plan. The first two are options that I can assist with. The third I cannot. Medicare supplements help to pay some of the out-of-pocket costs that come with original Medicare. These are the different plans that are available. The most often used plans in San Diego County are F, G, and N. Again, that's F, G, and N. There may be individuals on the call today that are in other areas, other counties, maybe Riverside County, LA County, or even in other states too. So I am licensed in several other states as well. So I can be a resource for you in your state. The coverage doesn't vary. The Medicare supplements are federally regulated, and so you will, the same coverage is available on a Plan G versus a Plan G from one company to another. It's also important to communicate to you right now, the big annual enrollment period right now, October 15th to December 7th, is more based upon the Medicare Advantage plans, more like the HMO plans and the prescription drug plans, as opposed to these Medicare supplements. The Medicare supplement enrollment opportunity is typically your birth month and your subsequent month with a guaranteed issue, no medical underwriting. So, but that's something I can discuss with you as well. So these are the different Medicare supplement plans. The most noteworthy plan is a Medicare Plan G. So you'll see right here on the chart that pretty much down the line, you'll see it covers 100%. And I'm going to go into the costs of the Medicare Plan G so you can know what that could cost to be able to access doctors nationwide that accept Medicare instead of a more regional type plan like a Medicare Advantage plan in San Diego that you need to typically go to see doctors within your network. But this will give you greater flexibility nationwide. The only real cost associated is a $240 Medicare Part B deductible. That's for doctors. So the only out-of-pocket costs on the supplements, besides your monthly premium, would be the deductible for Medicare Part B. So you'll see right here on a Plan G Medicare supplement, the rough cost at age 65 is about $130 a month and up. This will continue to go up as you age. Very important to note, your deductible is $240. There is a Plan F that's available, but you would have had to sign up for Medicare Part B by January 1st, 2020 to be able to access this and be grandfathered into this option. The premium on this is higher and there's no deductible. So important to know that there could be, it could be advantageous to switch from a Plan F to a G based upon the cost. In your 70s or 80s, it could be a benefit to make that switch. So this is what you would get. So if you wanted a Medicare supplement PPO plan, you'd have one card, which would be a Medicare Part A and B card. You'd have a second card, which would be a Medicare supplement card. And then thirdly, you'd have a Part D drug plan, separate from the Medicare and your Medicare supplement. You'd have three different cards. They would not be combined. They would be separate. If you have any questions about this or any other questions throughout the presentation, feel free to add those to the chat box because I'm happy to answer any specific questions that you have with the time that we have at the end as well. This is the Medicare Advantage Part C plan. There are different types. There's HMO plans internal to a network. There's more like PPO plans where there's an out-of-network option for you where you pay a higher cost for office visits or procedures or surgeries. There's a private fee, PFFS, private fee for service, which aren't as prominent in this particular area. And then there's also the special needs plans for those that have chronic ailments with heart concerns or with diabetes. So there's varying type of Medicare Part C plans. Then the best way to describe Part C is it's an acronym for combine. So it combines Medicare Part A hospitals, Medicare Part B doctors, and Medicare Part D drugs into one plan. It's more of a managed care plan within a particular company. So Medicare Advantage covers offered by private companies, companies like United Healthcare, Scan, Alignment, Aetna, Anthem Blue Cross, Blue Shield of California. So those are all types of companies that offer Medicare Part C plans. And in many cases, they include dental coverage or glasses or discounted hearing aids or gym programs, Part D drug coverage, and many of them have an annual out-of-pocket maximum to help protect against high costs. So these are the ones that you see a lot right now during the annual enrollment period. You know, there may be famous people like Joe Namath that are doing commercials. Every other commercial is specific to Medicare. This is that style of plan. And so it's really important for those on the call today that are currently on Medicare, if you do have a Medicare Advantage plan, to know what's available. There's a form that your insurance company should have provided you. It's called an ANOC form, Annual Notice of Change. And it's very important to compare your benefits from 2024 to 2025 so that you have a proper expectation on what the benefits will look like next year. Continuing on, the Medicare Advantage plans, you'll see typically have a $0 a month and up premium, typically a $0 annual deductible, $0 to $590 annual drug deductible. The coinsurance and the prescription cost varies based upon the tier levels on the medications, which I'll allude to in the next couple slides. But this is basically what you typically find in each Medicare Advantage plan is a little unique. Now, at the end of the presentation, I'm going to be highlighting one of the different plans that I work with in San Diego County. It may or may not be a plan that would be suitable for you based upon your doctors, but I think there's validity in just at least sharing with you the plan so that you'll know what type of features and benefits are available in this particular plan. So Medicare Part D drug plans, so you'll see that it does cover certain prescription drugs based on a guideline set by the federal government. Each plan decides which drugs to cover and which ones not to. Typically, they'll cover tier 1 and 2 generic medications. Tier 3 and 4 and 5 are more brand name or specialty medications that typically do tend to cost more money. And then additionally, there's validity to make sure that you are in the best Part D drug plan for the calendar year. Now, if you have a Medicare Advantage style plan, that typically does include drug coverage, specifically to the cost for Part D plans. That's typically if it's a standalone Part D drug plan in combination with a Medicare supplement. So you'll just see that the higher the tier level, the more you'll pay for your medications. Generally, drugs typically, generic drugs typically fall into tier 1 or possibly tier 2. So you will find that you will pay less if you go to a preferred pharmacy as compared to a standard pharmacy, or an out-of-network pharmacy is typically more like a mom and pop type pharmacy. But there's value in making sure so that you have the lowest cost medications. More of the big block stores like CVS, Walgreens, Rite Aid, Costco, Vons, those tend to be in most cases within the preferred network. So the Inflation Reduction Act of 2025 and beginning 2025, people with Part D plans through traditional Medicare and Medicare Advantage plans with prescription drug coverage won't pay more than $2,000 over the 2025 calendar year in out-of-pocket costs for their prescription medications. There's about 7% of the population, so I hear, that do pay more than $2,000 a year for their medications. So this will greatly benefit them because if it's a covered medication, covered is the key, then it will cap your medication costs at $2,000. Now, there's terms such as the coverage gap or the donut hole that will end December 31st, 2024. Currently, if you happen to be in the donut hole or the coverage gap for this year, in most cases, you pay 25% of the cost of the medication. That will end next year. So this is a big shakeup for Medicare Part B. I'm sorry, Part D. You'll see right here in 2025, the member will be responsible for upwards of $2,000. Again, as long as it's a covered medication depicted on the formulary. And then after 2,000, the plan will pay for covered medications. So it's important to communicate, like right now, the coverage gap or the donut hole for 2024, you pay 25% of the cost. And then in this year, the catastrophic phase, you pay 5% of the cost. But next year, the plan will pay those costs exceeding $2,000. So as a recap, the Inflation Reduction Act will remove the coverage gap. It will have a lower out-of-pocket maximum, and then the new prescription payment plan options available. So say your medication costs $500, you can split that up over $100 over like 5 months. So that's an option available as well if you need to be able to make payments on that. So this is Part D drug plans. So you'll see the standalone drug plans roughly are $17 a month and up. If bundled with the Part D Medicare or Part C Medicare Advantage plan, it's typically $0 a month and up. There's an annual deductible upwards of $590 that would need to be satisfied before the insurance company would start paying. And then the prescription costs vary based upon the plan and the tier levels that the medications fall under. This is the enrollment. So you basically, it will automatically enroll you at age 65 if you're receiving Social Security benefits or railroad benefits. Now that doesn't mean that if you currently have group health insurance that's as good or better than Medicare, you can request it to come off, but it will automatically turn you on at 65. You could also self-enroll yourself at 65. So maybe you've been retired for a couple of years prior to 65. The way to sign up and enroll yourself is it's a 7-month window. It's called your initial enrollment period. So you have 3 months before your 65th birth month, and then 3 months after to be able to sign up for Medicare Parts A, hospital, Part B, doctors. And this is the opportunity. It's called your initial enrollment period. So here's a couple of common examples. So we have Mary, who leaves her employer group coverage at age 65. She enrolls in Medicare Parts A and B, and then she chooses her health plan and her drug plan. We have Bill, who continues employer coverage. He turns 65 in April. He enrolls only in Medicare Part A for hospitals. There's no cost associated with being in Part A. And again, as long as you paid into Medicare at least 10 years in your career. He's going to delay Part B doctors. He's going to continue employer coverage, credible coverage. And then at 67, he leaves his employer coverage, and then he enrolls in a Medicare Part B within 60 days of retiring from his employer coverage. And then at that point, once his Medicare Part B is in effect, he can choose his health plan and his drug plan. So that's a couple examples. There are people that I work with that are still working, and they've deemed that going on Medicare is a better deal for them. So that's not out of the realm of possibilities, depending on how much you're paying for your group health insurance and what your benefits look like. It may make sense to forego your employer health insurance and go on to Medicare. So it's good to speak with a licensed Medicare agent to know if that would benefit you or not. So there are enrollment periods for Medicare Advantage plans. There's the annual enrollment period to switch from one Medicare Advantage plan to another. October 15th to December 7th. And then also, and that will go into effect January 1st. There's also special enrollment periods due to moving in and out of your coverage area, losing your coverage. I think just 1 second. I think I saw my screen flicker a little bit. So I'm not sure why that's happened, but or if you're a low income recipient, or if your plan is leaving the area, or if it's terminating, or other special situations like if you're moving into a senior living community. So these are special enrollment opportunities to change from one Medicare Advantage plan to another. So this is one of the plans that I was alluding to here in San Diego County. This may or may not be appropriate for you based upon your network of doctors, but I still wanted to share with you the details so you can kind of have an understanding of a particular plan available. This is the SCAN Alta plan. The SCAN is an acronym, Senior Care Action Network, and it's a good plan within Scripps Physicians Medical Group and Mercy Physicians Medical Group. Not Sharp or UCSD, but with a couple of the Scripps networks. You'll see the monthly plan premium is $0. The annual out-of-pocket maximum is $500 per calendar year, and the primary care visits are $0. Office visits are $0. Preventative services down the line are $0. Outpatient mental health is anywhere from $0 to $20. MRIs and CT scans are $0. Inpatient hospital care, you pay days 4 through 7 at $50 per day. And skilled nursing, you pay days 21 through 100 at $500 a day. The important thing to note here is the maximum out of pocket on this plan is $500. All the way down, ambulance services is $75. Emergency care worldwide is $90. Urgent care is $0. Medication costs are as follows. $0 tier 1 and 2 generic medications. And tier 1 and tier 3, 4, and 5, there are costs associated within this plan. So it's also really important to make sure that you know what your medications cost could be, not only for the last part of this year, but also for 2025. The plan also includes additional benefits for vision and hearing, transportation benefits, over-the-counter benefits, fitness programs, acupuncture and chiropractic, and then like meals post-surgery and telehealth visits, and a little bit of in-home care as well, post-hospital or skilled nursing facility stay. So these are the benefits on this plan. It's the SCAN Alta plan. I do know that there are folks on the call today that are within the Sharp network of doctors, or with the Scripps network of doctors, or with UCSD. There may be folks on the call today also with Kaiser. And so I just want to be available to you and help you the best way that I possibly can, and with what you're looking for. And this is that window of opportunity to make changes. And the next slide here will be my this is just referencing that I work within the Sharp, Scripps, and UCSD networks. Insurance companies like United Healthcare, Anthem, Blue Cross, Blue Shield, SCAN. I think okay. Pardon the interruption. I'm trying to navigate why my camera isn't working here, so I do apologize for that. So these are the network of doctors that I work within. I can provide the new benefits for 2025 for your insurance company within your network of doctors. And so this is my contact information right here, email, website, phone number. It's important to also communicate that I can't work with every plan available in the area. If you have specific questions about plans that I can't work with, it's best to contact 1-800-Medicare or go to medicare.gov. But happy to be a helpful resource for you. And again, if you happen to have any questions, kindly feel free to add them into the chat box, and I'm happy to be helpful.
Thank you, Kevin. That was a lot of good information. We appreciate that. Just as a reminder to everybody, if you do have a question, please utilize the Q&A function at the bottom of your screen or put it in the chat. We'll make sure that we can answer your questions for you. I did have a question in the chat about a scan. So you went over a plan with scan. So you work with scan programs.
Correct. Yeah. So there's a few plans with Scan. There's the Scan Classic plan, there's the Scan Alta plan, and there's the Scan Connections plan for those folks that are on Medicare and Medi-Cal. So I work with 3 different plans.
Do you know about Orange County plans? Do you know what group worked with Hogue in Orange County?
So I might have to look that up. I off the top of my head, I believe that could be United Healthcare. So I can look that up for you if you'd like.
Perfect, thank you. Another question came into the chat. Can you change from Medigap to Medicare Advantage during the annual enrollment without a penalty?
Correct. That would be the opportunity to go from a supplement or a Medigap to an Advantage plan. This would be that opportunity to do that. Yes, you have until December 7th to make that change.
And then is that effective January 1st then?
Yes, January 1st.
Okay. Another question on Medicare, just for clarification. It's only for the individual, not a family or dependents?
Correct. Yeah, these are individual based plans, but as I alluded to earlier, maybe one spouse did not ever pay into Medicare. That spouse could utilize their loved one's benefits to be able to be eligible as well.
Excellent, thank you.
But-
I'm sorry, go ahead.
I was gonna say, but not an independent, or not a dependent under 65. No.
Okay. In regards to Part B premiums, they vary based on income levels. Does that also apply to Part C plans?
No, Part C are set. They're set by the company, and in many cases in San Diego or Southern California, typically, as long as it's not a remote area, the premium should be 0 per month, and on most HMO style Medicare Advantage plans. So there's a variant of the Medicare Advantage plan that's a PPO style, which does offer an out-of-network consideration, which has a monthly premium. But I didn't go too deep into that today.
Okay, perfect, thank you. And then for clarification purposes, when you retire, applying for Part B, is it 60 days before you retire or 60 days after you retire?
So there's validity to receive 2 forms specifically, if you're inclined to write those down. It's called the CMS 40B form, CMS 40B, and then also the CMS L564. And just this morning, I emailed that to a few people that are anticipating coming off group health insurance in the next few months. And so those forms are readily available online. And those forms you give to your employer to fill out, so that saying that you've had health insurance since you turned 65, so you will not incur a penalty. That could be for the employee. That could also be for the loved one or the spouse that's been utilizing that health insurance.
Perfect. Another question. I'm currently with Scripps and was told Medicare would no longer be accepted in 2025. What plans are accepted?
So if you have a Medicare supplement or a Medigap plan, like a Plan G or a Plan F, you can go to Scripps. So there's different Scripps network of doctors. So just for clarity, Scripps Clinic and Scripps Coastal, two of the networks, are no longer going to accept Medicare Advantage plans for 2025. So if you are in one of those two networks, Scripps Clinic or Coastal, to stay with those networks, you're going to want a Medicare supplement or Medigap plan. So that's what you'll want. Now, if you're with Mercy Physicians Medical Group or Scripps Physicians or Optum Care or Primary Care Associates, then you would still be able to access not only the Scripps hospitals, but also but utilize a plan that I shared with today, like a Medicare Advantage plan.
Thank you. You mentioned other states. What other states are you licensed in?
So I'm licensed in Arizona, Texas, Washington, and a few other states in the Midwest and back east. It's not a lengthy process to get non-resident licensed. It takes no more than 3 to 5 days typically to get licensed. So I'm happy to assist in other states as well.
Well, we do have a member that is moving to Florida, and they wanted to know, are their plans the same there out in Florida versus compared to California?
Correct. Yeah, there's still those three options: Medicare supplements, Medicare Advantage plans, and then like federal plans or state plans through a former employer, which I cannot offer. But yes, they're similar type plans.
Okay. Question about managed plan. How do I sign up for a managed plan?
So a managed plan would be more of like an HMO Medicare Advantage plan. So as long as you have Medicare Parts A and B intact, then you can sign up for a Part C Medicare Advantage managed plan.
Okay, thank you. Now another question. If you're still working and have insurance coverage, all you need to do is complete Medicare Part A plan to sign up, correct? Or do you need to submit the CNS forms in order to not incur a penalty?
So yeah, if you're still working, kind of the analogy that I shared is Barry and Mary and Bill. Bill continued to work, so he signed up for Medicare Part A for hospitals, and he forgoed his Medicare Part B for doctors until he decided to retire at age 67. So you don't have to fill out those paperwork, but those two forms that I alluded to, CMS 40B and CMS L564, are forms that one of which you fill out, the other one you fill out the top part, your employer fills out the middle part and signs a date saying you've had health insurance since you turned 65 so that you don't incur a penalty. So you don't really have to do anything. If you deem that staying on group health insurance would be the most appropriate for you.
Got it. Thank you. Now, does the cost of Medigap supplement plan vary according to household income levels?
It does not. So the cost for the Medicare supplements is determined by each company. So the plan details from a Plan G with one company to a Plan G with another company is federally regulated, and so the benefits are the same. The main difference is their premiums per month. So if you have a higher or a lower income, that would not determine your premium. Your premium is set based upon your age. In the state of California, it's based upon your age. So as you age, the premiums will continue to go up. So it's also really important on an annual basis, your birth month and the subsequent month. It's called your birthday rule. It's in California. Anyone on the call that's not in California, probably not applicable in your state. But in California, we have what's called the birthday rule. It's a guaranteed issue, no medical health underwriting. Your birth month and then the subsequent month to change from one Medicare supplement to another without having to go through full medical underwriting.
Perfect. Now, we've been talking about Medicare. Do you know who qualifies for Medi-Cal?
So Health and Human Services would be your best place to go to in San Diego County or in your county to determine your Medi-Cal eligibility. Typically, it's roughly under $1,700 a month is your income that you'd be eligible for Medi-Cal. Medi-Cal used to be also asset driven, but as of recent, in the last year, that's not a determinant on Medi-Cal. Medi-Cal is income driven, and if it's under roughly $1,700 a month, I believe it's under $21,000 a year, determines your Medi-Cal status. Now, there's also important thing to note that with Medi-Cal, there's also particular share of cost, and so that would have to be determined to determine which type of Medicare Advantage or Part C plan would be appropriate. If you have a high share of cost, you may not want to go onto a Medi-Cal Medicare style Medicare Advantage plan. It's all determined on what your share of cost might be.
Got it. And a lot of our members online here today are currently employed. So is there any benefit to enrolling in the Medicare Plan A while you are still covered through your employer?
Just as a secondary coverage, do I have some people, even as recent as this morning, that are over the age of 65 on group health insurance that have not signed up for Part A? It's another step that you would just need to do at that time when you decide to come off group health insurance. But an example would be, so say maybe you want to go on Medicare December 1st. So those two forms that I shared, you'll want to get those filled out now and typically submitted in the month of November, so that your Medicare Part A or in this case Part B, because those forms specifically are for Part B for doctors, and those forms would need to be submitted in the month of November, typically for a December 1st effective date. Part A additionally would need to be signed up if you haven't signed up for hospitals by calling Medicare or your local Social Security number to get Part B hospitals set up as well. So it's an extra step that you would need to take. It's ideal if you could already have your Medicare number set up and your Part A turned on, so that you wouldn't have to do that as well. And then like where I come into play, or another licensed Medicare agent, once we know that your Medicare Part A and B are both in effect, say for December 1st, then we can help with one of those two options, either the supplement or the Advantage plan.
Perfect. Thank you. Another state question, licensing. New York, North Carolina, and Georgia. Are you licensed there?
So I'm not licensed in New York. They do make you jump through extra hoops in New York. I have referred that out to colleagues of mine in the past. I am not licensed in North Carolina or Georgia. Again, the process isn't too extensive, and in the computer age that we live in, it's pretty easy to navigate the specific plans in those states. So that's where I come into play. I'm not currently licensed in those, but in the past I've been licensed in South Dakota and South Carolina and Ohio and West Virginia and in Kentucky, but I'm not currently licensed in those couple of states.
Great. And I know we're going to do a session on long-term care, but any updates on California's long-term care program?
So long-term care insurance is very important. If you haven't considered that, or maybe if you've gone through an experience with a loved one or family member, then my encouragement would be to see what options are available to you. We will be doing a seminar hopefully in the next couple months, but if you have specific questions about long-term care insurance, my website's right there, my phone number. That's a space that I have options in as well. That industry is always changing. That particular question may be relevant to the California Partnership for Long-Term Care, if it is, there are minimum requirements for that particular plan. But that type of plan can protect your assets towards the Medi-Cal spend down level. Not as critical as it was prior to that, to the rule that was passed a year ago, because the value in the California Partnership for Long-Term Care Plans is that it would protect dollar for dollar your assets towards that spend down level. So it's not as valuable specifically with that plan, but there is value in having long-term care insurance, and it can provide a safety net and peace of mind for you to take that pressure off your family and be able to protect your assets and give you freedom of choice of care, including care at home.
So we sincerely hope that you've gained some valuable information from today, and your presence has truly made a difference, and we appreciate you taking the time out of your busy day to join us this session. Now, until we meet again next month, wishing you continued success on your path to financial well-being. We'll see you all next month.